Okay, the topic is paradoxical breathing after cervical cord injury. So before starting this topic, I would like to brief about the mechanics of diaphragm, normal mechanics of diaphragm. So you know that the origin of the diaphragm muscle is there are three origins are there, and insertion is central tendon. So three origin is first origin is it takes origin in the upper margin of the lower six ribs. That is the origin, first origin, and second origin is these are the vertebrae, posterior side, and second origin is the zipisternum process, xiphoid process, posterior surface of the xiphoid process. That is second origin. And third origin is L1, L2, and L3 vertebra. There are two crusts. There is right crust and left crust. There is crural part. There are three parts: sternal part, costal part, and crural part. Sternal part it takes origin from the posterior surface of the xiphoid process, and the costal part is upper border of the inner surface upper border of the lower six vertebrae, and third is crural part, that is L1, L2. That is, there are two crusts, are the right crust and left crust. So it takes origin from zipisternum process, costal origin, and from back crural part. So everything it comes and it is attached to the central tendon. So this is the central tendon. So it is, if I am, so this is right hemidiaphragm, left hemidiaphragm, and this is the central tendon of the diaphragm. So this is the insertion of the diaphragm. Okay. So the diaphragm in parts, the central tendon, it is the base of the, it forms the base of the thorax and roof of the abdomen. The diaphragm, central tendon of the diaphragm, it forms base of the thorax and roof of the abdomen. Okay. So the movement of the diaphragm, three forces which opposes the movement of the diaphragm. You know, during inspiration, the diaphragm it goes down, and during expiration, again it comes to normal position. You know this. So the movement of the diaphragm during inspiration, the movement of the diaphragm is restricted by three forces. One is the content of the abdomen itself. Abdominal content will resist the downward movement of the diaphragm. That is first. And what is the second force? The second thing which is opposing the diaphragmatic movement during inspiration is increased intra-abdominal pressure. Increased because when the diaphragm is going down, the pressure in the abdomen will increase and it will restrict the movement of the diaphragm. Right? And third third force which is restricting the movement of the diaphragm is the passive tension in the rectus abdominis muscle. Passive tension in the rectus abdominis. You know, rectus abdominis muscle is present in front, right? So what happens when the diaphragm is moving down? The abdominal content will be pushed down, and the abdominal content will try to move forward and backward, right? When the diaphragm is moving down, abdominal content will try to move forward and backward. When it tries to move backward, you know there are vertebrae are there, so it cannot move back. So it will try to move front, right? When you are doing inspiration, abdominal content will try to come forward. The passive tension in the rectus abdominis muscle will stop the movement of the abdominal content coming forward, right? So the passive tension of the rectus abdominis muscle is also the force which is opposing the downward movement of the diaphragm. So these are the three forces which restrict the downward movement of the diaphragm. Okay. So now coming to the contribution. So what is the contribution of diaphragm in normal breathing? Who can tell? Okay, what is the contribution of, you know what is vital capacity? Vital capacity, how much, what is the vital capacity? Normal vital capacity. What is vital capacity? Physiology you might have studied. So what is vital capacity here? So this is residual volume, tidal volume, inspiratory reserve volume and expiratory reserve volume. So these three together it is called as vital capacity and it is approximately 4500 ml. So if you know the muscles of respirations are primary diaphragm is the chief muscle and external intercostal muscles. There are of course there are many other accessory muscles, but main muscles are diaphragm and external intercostal muscles, right? The contribution of diaphragm in this 4500 ml is 3000. That is 3000 ml out of this 4500 ml. Out of this 4500, that is in deep breathing. When you take deep inspiration and you will do forceful expiration, right? So this amount you cannot exhale. So the rest of the amount is called as vital capacity, right? So in vital capacity, 60 to 80% of the vital capacity contribution is by the diaphragm, right? So rest 1500 ml is external intercostal muscle. Are you getting? Total vital capacity is 4500 ml. Out of 4500 ml, the contribution of diaphragm is 3000 ml. That is 60 to 80% of the vital capacity is contributed by the contraction of the diaphragm muscle. Right? Okay. So what is the function of diaphragm? Who can tell? Okay. In other words, what is the diaphragm is going down during inspiration when the diaphragm is contracting? Which diameter is increasing? Vertical diameter or AP diameter or lateral diameter? Which diameter is increased? This is chest wall and this is diaphragm, right? When the diaphragm is contracting, that is during inspiration, the diaphragm it comes down. So which diameter is increased? Vertical diameter is increased during inspiration, right? And when the diaphragm is contracting, even the AP diameter and lateral diameter is also increased, right? When the diaphragm is contracting, not only the lateral diameter increases, the AP and anterior-posterior diameter and lateral diameter also increase. How? See what I have told. When the diaphragm is contracting, so what are the three forces restricting the movement? First is abdominal content itself restrict the movement. Second, raised intra-abdominal pressure. Third, passive tension in the rectus abdominis. These are the three forces which are restricting the movement, right? So when you take inspiration, when you take normal inspiration, initially the diaphragm will go down. Initially the diaphragm will go down. Initially the diaphragm will go down and after some time the diaphragm stop moving. Why? Because these three forces is opposing the downward movement. So the central tendon after some time during inspiration, after initial inspiration, the diaphragm will go down and it will stop. Why it is stopping? Because the forces are restricting the movement of the diaphragm. So after some time, the central tendon will be stable, will become stable, and it will stop movement. Further contraction of the muscle will reverse the contraction. For example, this diagram. So this diagram, see the direction of the contraction of the muscle during initial inspiration is the diaphragm is moving down. So the direction of contraction is insertion to origin. What is insertion? Central tendon is the insertion, right? And origin is lower 6 rib, right? So the tendon will start moving down, right? The central tendon will start moving down, and the direction of contraction, muscle contraction, is from insertion to origin, right? After some time, when the central tendon is stopped moving, now when the muscle is further contract, what will happen? The origin, the muscle contraction will be reversed. That is, the muscle will now contract in opposite direction. That is from origin to insertion. When the muscle is contracting from origin to insertion, what happens? Now the ribs will start elevating. Are you clear? During initial part of the inspiration, when the diaphragm is contracting down, the direction of muscle contraction is from insertion to origin, right? So initially what happened? The vertical diameter is increased. After some time, the tendon will stop moving down, and if the inspiration is continuing, what happens? The muscle now will contract in the reverse direction, right? From origin to insertion. When the muscle is contracting from origin to insertion, what will happen now? The ribs will start elevating, right? So lateral movement and anterior-posterior movement will occur in the later part of the. So during initial part of the inspiration, the diaphragm will start moving down, the vertical diameter is increased, and when the central tendon is stabilized and when muscle contraction is in reverse direction, now the lateral diameter and AP diameter will start increasing. So don't think that diaphragm is increasing only vertical diameter. It increases the diameter of the thorax in all the three dimensions, right? Okay. So what is the nerve supply of a diaphragm? Put and tell. What is the nerve supply of diaphragm? Phrenic nerve. C3, C4 and C5. Right? Spinal nerve. So C4 is the main contribution for the C4 is the main right phrenic nerve and left phrenic nerve. Right? Okay. So when suppose if the patient is having C4 level injury, C4 level, below the C4 level lesion. So what are the what are the muscle will be paralyzed and which muscle will be escaped? If the patient is having cervical cord injury below the level of C4, which nerve will be escaped and which nerve will be injured? Phrenic nerve will be escaped because the main, suppose injuries at this level, right, below C4, the phrenic nerve will escape, right, and diaphragm muscle will be escaped. And what are the muscles will be paralyzed in this case? Intercostal muscles and what are the other muscles we discussed now? Rectus, abdominis. So these two muscles will be, yes, all the muscles will be paralyzed. With respect to respiration, external intercostal muscles and the rectus abdominis muscle will also get paralyzed, right? So what will happen if the cervical cord is injured below the C4 lesion? When the person is doing inspiration, what happens? The diaphragm muscle will contract. Clear? So what is paradoxical breathing? Who can tell what is the meaning of paradoxical? Paradox breathing. Paradox. Normally when we do inspiration, right? When we do inspiration, chest wall it goes out, right? During inspiration, chest wall will go out, and during expiration, chest wall will move in, right? Paradoxical breathing, it will be reversed. When you do inspiration, chest wall will go in, and when you do expiration, chest wall will go out. So what is the reason? So suppose if this is the chest wall, right? And okay, there are three intercostal muscles, you know. What are the three intercostal muscles? This is external intercostal muscles, right? This is internal intercostal muscles, and this is innermost intercostal muscles. Three muscles are there, three layers of the intercostal muscles. What is the function of external intercostal? Inspiration. And internal intercostal? Oh, what is the function of internal intercostal muscles? Quiet expiration or forceful expiration? Forceful expiration. So what is there are other functions of intercostal muscles. Other main function of intercostal muscles is they stabilize the chest wall. That is the main function of the intercostal muscles. They stabilize the chest wall during inspiration and expiration. That is the main function of intercostal muscles. See, when the diaphragm muscle is contracting, what example we have taken? We have taken example below C4 level lesion, right? Phrenic nerve is intact, right? Diaphragm muscle is intact. Intercostal muscles are paralyzed. Intercostal muscles are supplied by thoracic nerve, right? So those muscles will be now paralyzed. So if the intercostal muscles are paralyzed, it cannot keep the thoracic wall stable. Right? What is the function of external intercostal muscle? It keeps the chest wall stable. Right? Now the muscles are paralyzed. So what will happen in this case? When the diaphragm muscle is contracting, I am talking of after cervical cord injury. Right? When the diaphragm muscle is contracting, what happens normally? The intrathoracic volume is increased. When the diaphragm is contracting, thorax के अंदर volume है वो increase हो गया. When volume is increased, what will happen? Pressure will, Boyle's law. Pressure will decrease when compared to atmospheric pressure. Right? When pressure is decreasing, air will enter into the chest wall. This is it normally happens, right? So, in order for the entry of air, what is required? Volume should increase and pressure should decrease. Then only the air will enter into the chest wall, right? So now what happened? Because the intercostal muscles are paralyzed, it cannot keep the thorax stable. When the diaphragm muscle is contracting, negative pressure is created into the chest wall. Because the chest wall is not stable, the thorax will, the chest wall will move inward. Are you getting what I am saying? Are you understanding? When the diaphragm muscle is contracting, negative pressure is created inside the chest wall. If the external intercostal muscles are normal, then what will happen? It will keep the chest wall stable. In this case, the external intercostal muscles are paralyzed and it cannot keep the chest wall stable, because when the diaphragm is contracting down and negative pressure is created inside the chest wall, now what happens? The chest wall will suck in. Are you clear? So now what happens? The intrathoracic volume is not increased. Instead, it decreases. Are you clear? So, normally what is vital capacity? Vital capacity is 4500 ml. Contribution of diaphragm is 3000 ml. Right? After the cervical cord injury, the vital capacity will go to 300 ml. What is normal? 3000 ml. After paralysis of the intercostal muscle, the vital capacity goes down from 3000 to 300. That is less than tidal volume. So the patient should be immediately ventilated, otherwise he is going to die in the initial stage. Right? So when the chest wall, okay. So gradually what happens? The later stage, now the muscles are flaccid. In the beginning stage, the muscles are flaccid paralysis. As time goes, what happened? The muscle, the rigidity, the chest wall will become rigid. Right? The chest wall will become rigid, and now what happens? The chest wall will not move in or move out. In the initial stage, the muscles are paralyzed, right? Flaccid. So what happens? It cannot keep the thorax stable. As time goes, what happens? The rigidity develops, and the chest wall will become rigid, and it will not either move in or it will not move out. Are you clear what I am saying? So now what happens when the diaphragm muscle is contracting? Maximum vital capacity you can achieve is 3000 ml, which is the contribution of the diaphragm. You cannot achieve this 1500 ml. Why? Because 15 ml is the contribution of the 1500 is the contribution of intercostal muscles, because intercostal muscles are paralyzed and there is no movement of the chest wall, so you cannot achieve this 1500 ml. Are you clear? Initially the vital capacity will go to 300, and in the later stage, when the rigidity of the muscle, when the rigidity develops, maximum vital capacity which can be achieved is 3000 and not 4500 ml. Are you clear? Second is the beginning stage, what I have told, the passive tension in the rectus abdominis will restrict the abdominal movement, right? When the passive tension in the rectus abdominis is responsible for lateral movement and anterior posterior movement of the chest wall. Are you clear what I am saying? Now what happened after cervical cord injury? The rectus abdominis muscles are paralyzed, right? When the diaphragm is contracting now, what will happen? The abdominal content will move forward. Because the rectus abdominis muscles are paralyzed, it cannot keep the abdomen or the abdominal content stable. What will happen? In this case, when the diaphragm is moving down, abdomen will move forward. Because abdomen is moving forward, now the diaphragm will continue moving downward. Are you understanding what I am saying? When the rectus abdominis muscle is strong enough, passive tension in the rectus abdominis will stop the movement of the diaphragm and the contraction is reversed. Now this movement is not possible. That is, the diaphragm muscle will contract only in the single direction. Because rectus muscles are paralyzed, when the diaphragm is contracting inferiorly, the rectus abdominis muscle cannot stop the abdominal content, and the diaphragm muscle will continue in moving down. So now in this case, the only vertical diameter is increased, not lateral diameter and AP diameter is increased. Are you clear? So this 3000 ml will be achieved only when the vertical diameter, lateral diameter and AP diameter is increased. That is, interthoracic volume should increase in all the 3 dimensions. Then only the 3000 ml can be achieved. In this case, after the cervical cord injury, only the lateral diameter is increased, only vertical diameter is increased, AP and lateral diameter is not increased. You can achieve the maximum up to 2500 ml to 3000 ml only can be achieved.